Hello and welcome to Health Matters on Channels Television. Thanks for joining us. I am Mary Alale Yusuf. Globally, by the morning of April the 18th, more than 2.2 million COVID-19 infections had been confirmed in 185 countries. Of these, more than 150,000 deaths had occurred, but more than 500,000 people recovered from the disease and have been discharged. The United States of America now has well over 3 times the confirmed cases in Spain, which has the highest number in Europe. In Nigeria, in the considered window of time, there were 493 confirmed cases of COVID-19 in 19 states and the FCT, 159 recoveries, and 17 deaths. Lagos State, still the epicenter of Nigeria's outbreak, had 283 confirmed cases, which translates to about 57% of the country's case burden. My guest is a public health physician and member of the Association of Medical Officers of Health in Nigeria. That's Dr. Adeleke Awolesi. You're welcome to the show, sir.
Thank you very much, ma.
You now say you're doing house-to-house contact tracing. You know, when we heard it, we didn't believe for the enormity of, what that means. How is this happening?
Okay, thank you very much. You would understand that Lagos State has a population of about 20 million people. And what we are actually doing is what we call community surveillance. Okay. We are trying to increase our dragnet to pick up cases that have COVID-19-like symptoms. And what do I mean by that? Fever, cough, and fatigue, sore throat. These are COVID-like 19 symptoms. So what we are doing is to go from house to house. We have teams going from door to door, asking, do you have anybody that is sick in this house? If they do have, then we can now pick them up and send them to centers for testing, centers close to them for testing.
And you are not asking about travel history this time?
For now, we are trying to expand, like I said, we're trying to expand our dragnet. We're trying to test as many people as possible. You would have heard in the news that we are trying to do that. So that's the essence of the community surveillance, to generate as many people who present with COVID-like symptoms for testing.
But that means that you have to have acquired a huge number of test kits or testing ability over time. How did that happen?
Yes. What we are doing in Lagos State is that NCDC, in partnership with the Lagos State Primary Health Care Board, is trying to decentralize the testing. You would have heard in the news being said by the NCDC DG. So, like in my local government, Kushofe, we have one testing site at, we don't want to mention the name of the place, so as not to stigmatize the center. So this is being done across the states. And I think Alimosho has over 4 sites. So in each of these sites, we try to, from the community surveillance, and we are also doing what we call health facility active case search. We go to all the private and public health institutions or health facilities across each LGAs in the 20 local governments in Lagos State, searching through their records over a 3-month time period and checking if they have cough, fever, fatigue, sore throat like symptoms. Maybe we've missed them somewhere, so they can get tested.
So you trace even those people from the register?
Yes, ma'am.
And you get them tested?
Yes, ma'am. And people would have had calls from us. Many people uncooperative, but we still appeal to them to come to our centers for tracing. We are doing that much of work.
Enormous amount of work.
Yes,
what has your experience been since you started this method?
Well, I just want to appeal to the people. These decisions are very difficult decisions for government to make. The lockdown in itself is not the solution to this pandemic. The lockdown is to slow the spread of this disease. And you must assist the government by staying at home. My experience is that a lot of our people are not cooperative. There are a number too that are cooperative, but a lot of people are not cooperative. They are very insultive when you call them. But then,
Do they
because we are trained,
refuse the tests?
some do, but we still appeal to them. We call them a couple of times, over and over again. Oh, this is a test that we should all do. It's in the interest of everybody. We tell them, we appeal to them. So maybe I should use this opportunity to appeal to everybody to assist the government. It should be a partnership, like it was discussed since the influenza pandemic of 1918. There has not been any major challenge to the survival of humans as COVID-19, and we should see it like that. You will notice even in Lagos, from Sunday to Thursday, we had over 100. Now, within 2 days, we are having another 100. Who knows what the figures will be today? So we must partner with government to keep these figures down.
The NCDC DG was talking about something like a one-stop lab, where the labs will be equipped to detect any sort of infectious problem, not just COVID-19, not just tuberculosis, not just any other infectious disease. What do you think this will bring to the table for us?
Yes, it will assist us in what it would reinforce our surveillance system. What he's trying to say is that there's a surveillance system in place already where it is sensitive to pick what we call notifiable disease. If you have a lab like that, all these works, we've been doing them even pre-COVID-19, especially for polio.
Lassa fever.
Yes, Lassa fever, and then acute flaccid paralysis in terms of polio.
Yes.
And so this will assist us. It will further strengthen the systems that have been put in place to detect and pick up diseases like this. COVID-19 was picked up in China as through this system, through an efficient system, picked up by a doctor, sent to their local CDC. And from their local CDC, they escalated to the national, and from there to WHO. Mm-hmm. So this kind of thing would help to strengthen our system. It's a step in the right direction.
Okay. You were talking about the increase in number of confirmed positive cases.
This one.
Are you concerned? I mean, in one day, between the 16th and the 17th, the jump, 51 new positive cases. Does that give you cause for concern?
Yes, it does. And that was why I was appealing to our people. When you move, the virus moves. This is an airborne disease. Let me use that word. At least we all agree. Droplets, we all agree. Maybe aerosols.
You know it's thrown into the air.
Yes, we don't agree. But this is something we all breathe in air, and so it moves fast. And if you see the figures, you will see the doubling rate. It took the whole world almost 4 or 5 weeks to get to 100,000 cases. Now we are at 2.2 million. WHO was saying that we could get to 10 million in 6 months.
Wow.
We are appealing to people, please, this lockdown must be enforced. We should stay at home. The more we move, the more the numbers go up. Please stay at home. Okay,
so when you go door to door the way
yes,
you do, you ask about those who have been coughing and all that. Then you take their samples, right?
No.
You're not the ones who take the samples. No. What do you do?
They inform, they fill an online questionnaire. We call it ODK. Okay. They fill it, and the information is sent back to a server. Then when they come, they give us also manual manual information
Questionnaire.
written on the paper.
Okay.
And so we take the efforts, we call everybody that is on that sheet. Oh, just like the health facility one where we go through the registers in private hospitals. Everybody that we see that has a cough, just like them, we call them and then we appeal to them to come for testing.
Okay.
In
Okay.
our center. Yes, sir.
Now, how many tests would you say we are averaging in Lagos per day?
With the new scale up, I think our goal is to achieve at least 2,000 testing per day.
Okay. Will that be enough?
Yes, it will be, though coming late, it's a step in the right direction. Because Ghana, with almost just less than 5 million population, have tested over 37,000 people, while at that time, Nigeria had only tested 5,000.
Is that a function of not having enough doctors or not having enough tests or not putting the structure in time?
Well, I wouldn't want to say that. But what I would like to say is that it's been scaled up. We should make the best use of it. If you are coughing, you have these symptoms, please walk up to any center. There's a center in Lagos, I'm sure of that. There's a center not far away from you. So avail yourself of that facility, of that opportunity.
Okay, so I would want you to cast your mind back to the first 2 weeks of lockdown.
Okay.
And what were the gains of that lockdown? And what is the difference between those first 2 weeks and the time we've spent in the extension of the lockdown? Have there been improvements or has it gotten worse?
I still see a lot of people moving around. I stay in Ikorodu, and when I get to the garage roundabout before I move to my area, I see a lot of people. I see a lot of people in the markets. Going out in the morning, I see a lot of people coming out to go out, and I'm wondering, where are they going? Fine, we need to feed, we need our markets opened, but it has to be in an organized fashion. It has to be organized. You see, China was able to do what they did because they were very disciplined. They acted fast, according to their CDC director. Said they were fast in their approach. We too must do this. Government has told us to stay at home, and I can understand why they don't want to maybe enforce or do something like a crackdown. But we, the people, must be convinced that we need to stay at home. And
Okay.
these 2 weeks...
I need to pause you there. I already have a question from Idris, and he's saying, if you come in contact with a person who has COVID-19 and the person does not sneeze or cough, can you be affected?
Yes, you can still be affected. It's been proven that breathing in and exhaling, you can also transmit. In China, it was found that over 55% of 55% of asymptomatic cases were still transmitting. And so, yes, you can get it from such a person.
Olasukomi wants to know, is there any provision for volunteer health workers, especially public health professionals, to join the contact tracing group? If so, what's the process? Maybe he wants to join.
The Lagos State government already put up an advert some weeks back for volunteers, and they've been very, very active with in terms of the case search, the community surveillance. Volunteers have been wonderful. They've been assisting us all the way. So it's easy. I think you could check online and find the phone numbers where you could just drop your number and you'll be contacted. And thanks for volunteering. We need as many people as possible. Thank you very much.
Okay. So keep the questions coming. You said something, that really concerned me. I got concerned that professionals are saying that if this thing is not handled well, in 6 months it'll be like 10 million or so.
Yes, WHO made that 10
Are we
million.
looking at 6 months of this pandemic? 6 more months?
You will understand that this disease, there's no immunity to it. Like it is being called, it is called novel, new.
New, yes.
There's no treatment protocol. There's no vaccine for it. there are two different strategies. One is the mitigation strategy, the other one is the suppression strategy. Both of them, they involve the implementation of several non-pharmaceutical interventions.
Okay.
And what these two strategies have told us is that you just need to slow down. Mitigation means reducing the spread, while suppression is trying to reverse the curve. But what we are saying is that if we don't implement all these strategies together till a vaccine comes,
Okay.
we might still be going and coming over this.
Let's take this call from Abubakar in Suleja. Hello, Abubakar.
Hello, good morning, ma'am.
Good morning. What's your question?
Madam, my question has to do with the policies that the federal government laid on ground in preventing the COVID-19.
You want to know what those policies are?
So, yeah, like in Suleja, the market will be locked down for 5 days. And it will be open, like last week it was open 4 days ago. If you see the gridlock in the market, it's better to even leave the market open than to lock it.
Okay.
Human traffic in that market on that day is unbearable. Because
All right.
many people walking into the market, they face the risk of contracting the sickness. So I don't know what government can do about it. Locking the market is not solving the problem at all. It's worsening the situation.
Thank you, Abubakar. So that has been the complaint of a lot of people, that the markets open and then everybody just floods the market, and it defeats the purpose. So what should happen? How do we solve this?
I already said it should be a more organized market system. The government has access to the leadership of the market, and they can actually tell them to observe social distancing. The market should be more spaced, well spaced, maybe evenly or otherwise.
And maybe people don't have to go every time the market opens. They can buy in bulk and keep at home.
Then that brings into question storage,
Okay.
processing
Well, to each
issues,
his own, I guess.
light issues, and all that. What I'm saying is that you can actually tell these markets to open at certain times, but then they need to be well spaced. You see people clumping up together, even in supermarkets. I've been to a couple of supermarkets.
Must not clump up.
No.
That
they
defeats
must not.
Everything.
Entirely.
Let me give you this question from Abdul Ganiyu. He says, how do we handle the burial of a COVID-19 corpse?
Well, you will remember very well, the Minister for Information had said that the body would not be released to families. And such bodies are supposed to be handled by the state. They have a procedure and a protocol in place for managing such bodies. And so I would like to keep it that way.
Okay, let's quickly take Nuruddin. Hello, Nuruddin.
Yeah, good afternoon, Ma. Good afternoon, Doctor. Well done. As regard to this COVID-19, I want a clarification. One, sweating, is it part of the same sweating if, for example, accidentally, someone that is not coughing or is not sneezing and has sweating, is it a part of the symptoms or something we should avoid to contact with the person, anybody presently?
Okay, okay. Thank you very much. I think what he's trying to say is, can you catch it from somebody's sweat?
No, it's not proven.
Okay.
It's not proven yet.
Holyfield is asking, can someone who tested negative come back to have COVID-19 in the near future, or does the person never have it again?
I didn't get that, please.
That's somebody had COVID-19.
Okay, became negative.
Yeah, became negative. Can he come back to be positive, or is he free forever?
Well, like I said, this disease is new, it's novel, but we are expecting that such people should have a bit of herd immunity. So we are not expecting them to have it again. But then, like I said, it is still new. A lot of studies we are still studying what the disease is all about.
Okay, so I'm going to ask you to briefly tell us, what are your concerns? What do you want to tell the public about COVID-19 to make your job easier?
Well, I would like to appeal to everybody.
Okay, let's just quickly take Ngozi from K2.
Okay.
Let's see if we can fit all this together. Hello, Ngozi.
Hello, good morning.
What's your question? Good afternoon.
Oh, sorry. My question is, I'm online now, I'm watching you people. So I saw where they showed the test, where they are testing people and all that. And they were wearing hand gloves, testing. Yeah, my question is like, is it when you are testing somebody with hand gloves, after putting that in another person's mouth, you still use it in another person's mouth again? If the person that has it and you use it in another person, you are infecting the person also.
Thank you, Ngozi. But I will let the doctor explain. He knows how this thing is done. She is claiming that this testing here, the person uses the same gloves for more than one person.
No.
Now, is that possible?
No, it's not possible. It's against the IPC protocol. Each person should have, there's a protocol in place. That's the infection prevention protocol. And
okay.
That is not what the person should do.
It means you use a fresh set of gloves for each patient.
Each and every one of the patients.
And sometimes for each procedure, even on the same person.
Yes.
Isn't that right?
Yes, you are correct. Like I said, it's a protocol and it's in place. In our sample collection sites, we even have an IPC officer, who is a medical doctor, that is in charge of making sure that there is strict adherence to infection prevention protocols.
Okay, this is a yes or no question. Can it be transferred through money, paper currency?
It's been said that, like I said, this disease is novel, and
so
a
lots
lot
of things
research
are still being found out.
Yes, they've said even China was soaking their money in deep
okay,
whatever.
We're going to have to stop there. It means that people are still trying to find out. Thank you so much, Dr. Awolesi, for coming and throwing so much light on this topic. Thanks at home for watching us. Please stay at home unless you are essential services or you really have to go out for an emergency or to the market. Stay home, stay safe. I'm Mary Alale Yusuf.